So we want to talk to you about the advantages of supporting an adult at home. And these are some of the things that kind of highlight, that we wanted to highlight. The first is, and you'll hear from Shira, how this can be less disruptive to their lives, whether they are in school or working or just living their lives. Being treated at home allows them to work and go to school much more so than being physically in a program. People who can recover at home also learn recovery in the real world. And those of you who may have had people in your lives go to higher levels of care know that they can do well in this kind of artificial environment for a time, but then they have to transition home. And I know so many of the people that I've worked with really struggle during these transitions and have to then relearn recovery skills in an entirely different setting. So when someone learns recovery skills in the home, they're actually learning them in the real world. As you are all aware, treatment centers are very, very expensive. And so there's definitely a cost benefit to being able to provide support to people at home. And finally, as you'll hear from Shira's story, there's the opportunity for much more individualized care. And I think this is really important, especially for people in larger bodies, people with marginalized identities, and also, as I'm seeing a lot in my practice, people with ARFID who may have very particular food needs that can't always be met in higher levels of care. So we're assuming that you all have at least a basic understanding of what family-based treatment is. And the way I thought about this talk and what the support that was provided for Shira was really around translating family-based treatment principles into treatment for adults. And there is, as you know, family-based treatment is a treatment that was designed primarily for adolescents. There are a lot of us who employ it with adults of all ages. I certainly have worked with a lot of adults who have been supported by family members, and I love it as a treatment option. And there are not yet clinical studies of using it with adults. There are some clinical cases and a case series that have been reported, and it's talked about as FBT-TE, which is family-based treatment for transition age youth, which is typically thought to be age 25. But I just want to share that I don't think there's a limit to the age. There's one colleague of mine who reported she used this with a person in their 60s who was supported by adult children. So I think it gives us a lot more options. The modifications for family-based treatment when using it with an adult is that it's more collaborative. So usually the young adult or the adult plays a bigger role than an adolescent does. Another aspect of doing FBT with adults is that it's the family of choice. So adolescents typically always live with adolescents. For adults, they may live with a spouse or a partner, roommates. And as you'll hear from Shira's story, she chose a different group of people to support her. We did look at her family, and we tried to arrange it, but for various reasons, which she can speak to more, her family was unable to do this. So it involved Shira choosing her family of choice. The developmental issues are different, obviously, with adults than with adolescents. And, again, they're typically more independent. And then when FBT is done with a therapist guiding the treatment, typically the therapist spends more time with the actual patient than they do in adolescent FBT.